welcome back. So it's so nice to be back. So we're doing surgery week. Since this is my first day back after having surgery, I'm 2 weeks post-op, and so happy to be here.
We missed you so much.
And I missed you guys. It's nice to be finally out of the house. Before we start on our surgery week, I want to read one of our testimonials. It's always fun for us. This is our candy. Just so you know, this is candy for us since we don't...
With no sugar.
Right. Well, it's kind of like our sugar. It's the sweetness we get. So this is from Give Me a Break. That's their title. Listening to these podcasts has given me new hope for dealing with lifelong anxiety and depression. I had 2 concussions as a child and early drug use. I'm inspired to further investigate all that Amen Clinics has to offer. It's awesome.
And that's why we're here. We're here for you. And I can't tell you how many times, for our patients, lifelong depression, concussions, and drug use go together. And so there is hope, there is healing for you through the Brain Warriors Way path. This is a path, a tribe, a community of people who want to have the best brains possible. One more testimonial. If you've ever just wondered, why do I do that? This podcast will answer that question and much more. As a teacher, I've always tried to focus on ways to help my students learn better, and focusing on what I can do to make my brain healthier will help my students also. Yes, getting well is about love. It's about love for yourself, love for the people in your life. I'm excited to teach my students how to get rid of the ants, the automatic negative thoughts, and also how they can protect their brains to become better students and people in this world. This podcast offers many topics about health and points to things you can do to help your brain.
I love that.
And one of the things you can do to help your brain is if you're sick and you need surgery, well, what are the things you can do to get ready for surgery? And then what are some of the things you can do afterwards?
Mm-hmm.
And last year I wrote a book called Memory Rescue that I'm thrilled with, and just went over 100,000 copies. So I'm even happier that more people are reading it. And in it, it has this super simple idea. If you want to keep your brain healthy or rescue it if it's headed for the dark place, you have to prevent or treat the 11 major risk factors that steal your mind. And I created a mnemonic, a memory device, called Bright Minds. And as I was thinking about surgery week, I'm like, well, these are still the same factors that are critical to take care of before surgery and afterwards. So let's talk about each of them as they relate to surgery and your overall health. So the B in Bright Minds is for blood flow. Mm-hmm. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease. And how do you know if you have low blood flow? If you have hypertension, any form of heart disease, if you don't exercise. Is that related to your overall physical condition before you go?
Yes. So this really, we're talking about surgery week. So my uncle, who just came in, I have an uncle who just came in to be scanned because he had open heart surgery. Now that's a much bigger...
subsequently had memory problems.
But that's a much bigger surgery than what I had. But this Bright Minds really applies to him, because with open heart surgery, you definitely have a higher risk of memory issues afterwards and depression. So this really triggered me to think of that. And so he came in, and one of the things he had was sleep apnea.
Which is the S in Bright Minds.
Yeah, so I won't jump ahead. But this really, since we're talking about surgery week, really made me think.
Well, I think Carol's just a great example.
Bright Minds is perfect.
Yeah. And so how do you help blood flow? It's exercise.
So I don't want to jump over that, because people listening need to hear that. And as a nurse, I think it's frustrating. And as somebody who has a loved one who's gone through open heart surgery, I want to mention that again. I don't know why more people don't tell patients that are going into open heart surgery that, oh, by the way, you may get depressed and have memory issues, because it scares the heck out of their families. It scares the heck out of them. That is one of the potential side effects. In fact, it's fairly common. So just know it, but know that there's something you can do.
And do the things
right.
you
Know
can
there's something
do.
you can do.
Because, in that last podcast, I mentioned hypnosis and how helpful it was after coronary surgery, decreased anxiety and depression. And hypnosis, I don't know if you know this, under a hypnotic trance, people have increased blood flow to the brain.
Right.
Especially to the focus and motivation parts of the brain. So if you want to increase blood flow, it's exercise, and then it's a healthy anti-inflammatory diet that also includes beets and rosemary.
You have to excuse me because I'm still post-surgical, so I have to wear my baggy clothes and sit on my pillow, and I'm adjusting myself. Sorry.
I have no words. R in Bright Minds is retirement and aging. The older you get, the more serious you have to be about your health because it's harder to heal the older you get.
Well, and there's this misconception that because I'm older, it's normal for my body to deteriorate and I shouldn't bite it. That's not true. So get that out of your head.
It's just the older you are, the more serious you
should be really paying attention and taking care of yourself and doing the things to fight that, to counter that.
I is for inflammation, which is a universal risk factor for anxiety, for depression, for dementia. So there's a blood test we do too, actually, C-reactive protein and the omega-3 index. If you have inflammation in your body, you want to make sure you take great care of your teeth. Periodontal disease is actually one of the major causes of inflammation. You want to be on an anti-inflammatory diet. So just, look at the Brain Warriors Way cookbook. Tana, that's how she cooks, which is basically lots of vegetables, healthy fat, and get rid of processed foods, sugar, and foods that turn to sugar.
And high quality protein.
And high quality protein. The G is genetics. That stuff runs in families, but as we say, genes are not a death sentence. They should be a wake-up call.
But let's just say, so I had to have surgery. Yeah, what was going on with me is genetic. Every woman in my family's had the same thing. Now, I take care of myself. We don't want you thinking that because if you take care of yourself and you have something happen and medically that you have to take care of, it's not your fault. Take care of it. But still, be sure you do all these things so that you recover better, so that you are less likely to get sick. But if you get sick, you can deal with it and handle it.
That's such an important point.
Right.
It's not your fault.
But do your part.
But your responsibility, and you're the one that taught me this, responsibility doesn't mean it's your fault.
Doesn't mean blame.
It means your ability to respond.
Right.
And that's what we want you as a brain warrior to respond in a helpful, thoughtful, healing way.
I always want 100% responsibility over what's going on with my health. Doesn't mean blame. But I don't want other people in control of it, okay? So I want to be able to, I want help. I don't want them in control. So I'm willing to take that responsibility. I've already been on the other side of that. It's not fun.
H is head trauma. You want to protect your brain, especially after surgery. We have a 2-story house.
Yeah.
And I'm watching this woman like a hawk.
Oh my God. He got so mad at me and I didn't want to wake him up and I started to get out of bed. I was still a little wonky. I was more than a little wonky. I was very drugged.
We'll do that in the next
But I started
podcast.
to get, I thought, I've already woken him up. I have to let him sleep because if he doesn't sleep, then he's not going to be able to do anything. And so I started to, he's like, don't you dare.
Right. Because the last thing I want is you to have a head injury.
Right.
You're temperamental enough as it is.
Maybe it would make me nicer.
I don't want to take that chance. Yeah, maybe 1 out of 100 actually does make people nicer. 99 times out of 100, they're not nice.
Yeah.
So,
well, there you go.
But that is so important. How often have we heard? Actually, at a recent event where somebody we know fell and was on the ground for 3 days with a broken pelvis. I mean,
really sad.
Really sad. So be thoughtful, be careful, and especially when you're under pain medicine, what was the word you used? Wonky?
Wonky.
I don't think that's in the medical textbook.
No.
But,
well, the other one we used,
you sort of get the idea.
But the other one we
You're
used in the ICU, where I worked, we also used gorked out a lot.
That's not nice.
But it's true.
but it's not nice. T is toxins. So anesthesia is a toxin. Actually, the reason I wanted to get her out of the hospital the same day is hospitals are toxic.
Yeah.
We've talked about this app you can get for your phone. It changes everything. It's called Think Dirty. It's not what you think it is. It's an app that allows you to scan your personal products, and it'll tell you on a scale of 1 to 10 how toxic they are.
Well, do you remember, like, they had, it's crazy. They didn't do this when I was in the hospital, but when I used to work in the hospital. This time when I went in, this was so different. They had me do that twice. I had to do that, like, crazy bacterial soap scrub, the same scrub they use for what the doctors scrub their hands with. I had to do that twice in the shower before I went. And then when we went, I had to use those crazy pads to wipe everything down to make sure you don't get these MRSA infections because the bugs are getting stronger now. So they want to make sure that you're not going to get an infection in surgery. But those things are, like, nasty. My skin itched and burned for, like, remember that?
I do.
It was terrible. So you got to wonder
and
what
so
that...
probably toxic stuff in there.
Right.
Too.
It's very toxic.
Because...
But you don't want to get an infection.
The hospitals, if you look at the food they serve and the kind of soap they have...
They could do better.
They could do better.
But they don't want you getting an infection, so I understand. So.
Which is really important.
Right.
M is mental health. So depression, as you said, is really common after some surgeries because the anesthesia can be,
and
not
the pain,
for everybody,
and then the pain meds.
Toxic for the brain. And then the pain meds, which are generally downers. You know?
Well, and let's not underestimate, you're not moving. And I don't know about other people, but when I'm in bed for very long, something happens.
Well, since you were a teenager, exercise has been your antidepressant.
It is, but most people, I think, if they just lay in bed all day, every day, it's terrible. So it just makes your whole body your whole system begins to just, like, drop. So, yeah, so that doesn't help.
So starting every day with today is going to be a great day. I'm going to give my uterus away. I'm going to donate because it has not been helpful to me.
Okay. You're a man. You don't get to say that. You don't get away with it.
But I lived with your uterus for a long time. And the trouble it was causing
pretty hostile.
you.
It just decided to go hostile one day. I don't know why.
Today is going to be a great day.
Yeah.
So start every day with today is going to be a great day. Finish every day with what went well today. So important to direct your mind in a helpful way. Where you bring your attention determines how you feel, right? If you think of all the things that went wrong in the healing process, it will actually delay your healing.
So, yeah, I want to talk about something. Probably we'll talk about it more in the next episode because I want to spend a little time on it.
Do you want to preview it to keep people with us?
Yeah, exactly.
You want to be like the news?
So there is.
Stay with us.
Well, there's one thing I think that can thwart a lot of this. And I had an epiphany about it when I was going through my recovery process because I was so prepared. And then I got thrown a little off track because of one of the
All right, so hold that thought
things.
so they have to listen to the next one.
Okay.
The second I is immunity and infection. So important for surgery that you want to strengthen your immune system. And a super simple way to do that is probiotics. They help your gut. Your gut is got a lot of immune function tissue. Make sure your vitamin D level is high normal. I say that over and over and over and over again, but I keep my level at 80. I think that's about where your level is.
Yeah.
Because that helps your immune system.
Right. And one of the things, you talked about your gut. So one of the big common problems, this is a little sidetrack, but I'm a nurse and I can't help it because this is just a nursing thing.
And after the anesthesia, your ADD is worse.
Okay, well, anyways, so this is a nursing thing and I can't help it. Post-surgical, someone's just got to say it, constipation is terrible, okay? It's just terrible. So because the medicine, when they actually put you under anesthesia and then they put you on painkillers, it causes this terrible problem. And one of the things that my doctor I actually know a lot about probiotics, but I never thought about using them because they actually help your gut to move more. And so to, like, clear things out, she's like, make sure you're taking your probiotics. I'm like, well, I do take them, but I didn't think about that for that reason. So I learned something new about probiotics.
When you went, Chloe and I clapped.
Okay, that was a little TMI, but...
All right,
funny.
So vitamin D, probiotics, mushrooms, garlic, and onions also help to enhance your immunity. The N in Bright Minds is neurohormone deficiencies, and your hormones are low, like testosterone or growth hormone or DHEA, thyroid. You don't heal as fast. They're hugely important to healing. D is diabetes. Oh my God, so important, with 40% of the American population obese, 50% diabetic or pre-diabetic. This is so important to eat in a healthy way, to get your blood sugar balanced, to be super serious. And then the S is sleep. So you're really good at trying to get 8 or even 9 hours of sleep before surgery, really trying to turn on health promoting genes. So if you don't get 7 hours of sleep at night, it actually turns off 700 health promoting genes.
So when I was working in the ICU, we often had to call psych down to help us with drugs, because people would get ICU psychosis from not sleeping. Because in the ICU, we have to wake you up sometimes every hour.
And we used to see that in the Army all the time. They do war games, and people be up for 3 days, and then they get goofy.
So if you come in with a head injury, we wake you up every hour and check your pupils. What do you think that does?
Mean.
Well, we have to.
But
what do you think that does for your sleep? And before we know it, people have ICU psychosis, and they're literally, you don't want to be taking care of them.
All right, when we come back, we are going to conclude Surgery Week with practical things, more practical things you can do to heal better, faster. Stay with us.